Hello and welcome. I'm Annette Reeder from thebiblicalnutritionist.com. And today I'm interviewing Dr. Tony Jimenez about children's cancers. It can be so heartbreaking for a young child to have cancer, yet it happens at an increasing rate in our country, in America. But it's also happening around the world. We have so many followers in other countries who are sending us stories every day of their children developing cancers. Well, we are not here to serve fear, but we are here to serve hope. So we're going to talk about the incidence of cancer and how that is rising. Yet, I don't want you to have fear. I want you to realize, as a parent or as a caregiver, or even a young person who might be watching this video, that we can share with you some hope about this and what we can do to be preventative as a parent to help our children to avoid circumstances that might lead to cancer. And if your children do have cancer, how we can help you through that. So, Dr. Tony Jimenez, it is an honor to have you here today. They're from Hope for Cancer. In your book, Hope for Cancer, and the seven foundations of that is an amazing book that everyone should have on their shelf and read it, at least a couple times a year, because there's so many takeaways in that book. And you do live by your word, hope. And that's what I love, because so many cancers are fed by the emotions, which I know you'll talk about. And we don't know how to walk in faith. And because of that, we are definitely a society that is more sick than we need to be. So, Dr. Tony, I'm so excited to have you here today. Let's get started with this.
Well, thank you so much, Annette, and the Biblical Nutritionist family for having me. And as you're talking, so many thoughts come to my mind about this so important topic. And I want to start with a story. In the US, a child that is diagnosed with cancer, the parents don't have a say in their treatments. And so if the parents want to do an integrative approach, or if the parents don't want their child to have chemotherapy and so forth, they don't have a choice. The state, the government decides this. So that's number one. So at Hope for Cancer currently, we do not treat children. Our goal is to at some point have a center for pediatric oncology, and children can have these treatments for free. So that's our prayer, that this can happen. The story I want to share is that in the year 2000, I opened our first Hope for Cancer Treatment Center in Tijuana, Mexico, just south of San Diego, California. 3 months after I opened the center, here comes a mom with her 6-year-old daughter. And she was diagnosed with leukemia in Illinois. And in Illinois, they had told the mom that with chemotherapy and a bone marrow transplant, she had 50-50 chance of survival. If she survived, 100% that she wouldn't be able to have children. So the mom didn't want this for her child. And this is 24 years ago, in 2000. So the rules and regulations were a bit different than they are now. So her mom found her way to me at Hope for Cancer in Tijuana, Mexico. And to cut a long story shorter, Whitney is my daughter. I walked her down the aisle, and Whitney is 30 years old now. She has 4 children, Beckham, Bo, Baylor, and Bloom. And of course, Marcy, her mom, is my wife, and we've been married for nearly 23 years. So there is a role of integrative oncology, integrative medicine in a child that is diagnosed with cancer. In Whitney's case, we did not do any conventional therapy. Whitney did not receive chemo or bone marrow transplant or any of that. She was healed by the grace of God and the wisdom that He gave me 24 years ago to help Whitney, 6 years old. One thing I want to point out, so that we don't doubt for a moment, Annette and viewers, that God is so good, because Whitney had to have blood transfusions due to the leukemia. One blood transfusion the donor's name and date of the blood was on it, and the name was Jesus, because it's in Mexico, Jesus.
Yeah.
And Whitney told us this story as an adult. She said, Dad and Mom, when I was getting that blood, I saw the word Jesus, because it's spelled the same, Jesus, Jesus.
Yeah.
And I thought I was getting the blood of Jesus. So whether it was my treatments, whether it was her believing that she was getting the blood of Jesus, the point is that there is more to be done for your children if you have a child that's been diagnosed with cancer than just the chemo, the bone marrow transplant, and the toxic therapies.
I understand exactly what you're saying, and I understand the truth of what you're saying. How do we give that parent hope if the child has first? Okay, let's start with the parent who's on this video because she is grasping for hope. How do we give a parent hope whose child does have cancer and they do live in the US? Let's start there, and then we'll move into the prevention mode.
The first thing is know that your child can be healed, independently of what the statistics say. Also know that there's work to be done beyond the conventional aspect of treatment. I would recommend that you find someone that is well trained in looking at the emotional spiritual correlation with the cancer. In our Cancun treatment centers, we have a pediatrician that works on what we call the behavioral, emotional, and spiritual transformation, our BEST program. And I say that to say that, of course, we can't work on a 3-year-old, 4-year-old on this aspect, but we work with the parents. What are their traumas? What are their conflicts? Was this a child that was wanted? Was this what was going on at the time of that conception and that birth, right? So we have to focus on that hope and that well-being of the child beyond the chemo, bone marrow transplant, or any other conventional therapy or integrative therapy for that matter. We need to see some of the deep foundational reasons because cancer doesn't just happen because, right? So we have to look at that. We have to look at possible viral um, contributors to cancer, like Epstein-Barr virus, cytomegalovirus, toxoplasmosis. So going to a physician who's well trained in investigating this and then giving natural therapies for potential viral components to cancer is very important. And of course, nutrition. Most pediatricians, with all due respect, because I knew nothing about nutrition either as a medical doctor. We're not taught that in medical school and in our training. So please go to a nutritionist who specializes in children so that he or she can guide you on proper nutrition for your child. Even if they don't have cancer, do that right now. It's
Oh,
very,
totally.
very important, right? And more so, of course, if there is a cancer diagnosis. So those are some areas that you can think about and research in your community, local areas, and I'm sure, Annette, you could provide some resources for your biblical nutritionist family as well.
Yes, for sure. And we will definitely be we'll be putting it together, after this video releases in regards to feeding your children well. But most of what we teach is just biblical foods, which applies to all ages. It doesn't matter what age it is that we're teaching about. It's biblical food is biblical food, and it's the same for everyone. So, but I know moms want that. Well, give me a book for my kids. So, okay, we can do that. We can definitely put that together for them. So, and then I liked what you said about the viral testing, and that's something they can request of their physician as well. So, and many times parents need to understand you are your child's advocate. And so you have to, you can ask nicely, but if the physician is obstinate against ordering anything other than what he agrees to, then you can just be more in demand about saying, no, I really want these tests done for my children. And there are times that you can order the test on your own too. So many times we encourage people to, you can do different lab work on your own. And even for your child, you can get this done and pay for it out of pocket. But if it saves you from going through a treatment that may not be necessary because you now have an underlying cause, it's just, we want to empower parents and realize you have options. And never walk out of an office in fear, always walk into an office with hope and leave with the same hope, knowing that there's answers out there for you. So, all right. So what next can we help parents with?
Well, one of the things, and it's a big topic, a lot of controversy, is vaccines, right? So vaccines, you need to do your research. You need to really vet this very carefully and decide if that is for your children or not. Vaccines is not only the viral component, the attenuated virus in the vaccine, but it's all the other aggregants that the vaccine injection has, whether it's trimerazole, a form of mercury, or it's fetal tissue extracts, whether it's other metals or toxic ingredients in the vaccines. Those are the real big culprits to disease. By the way, the story I share about Whitney when she was 6 years old, her mom didn't know any better at that time, and Whitney had all the vaccines when she was born and for the first 6 years up to her diagnosis. And at one point when Whitney got the vaccines, her eyes just went out like that.
Mm,
And she had to have 2 or 3 eye surgeries.
wow.
So consider, and the pediatric oncologist in Illinois at that time, remember this is in the year 2000, told Whitney's mom that he believed that this had a vaccine component, the onset of the leukemia. So whether it did or not, we can't prove it, but it is something for all the moms and dads out there to consider and do their research. And unfortunately, with respect to research and funding, I did a little investigation before this uh, podcast, and I found that only about 4% of the federal cancer research budget is allocated to pediatric oncology. About 4% of the federal cancer research budget. And for example, the NCI, the National Cancer Institute, has a yearly budget of $8 billion. That's
Wow.
billion with a B. And only 4% of that is being used for pediatric oncology. In 2024, it's estimated that nearly 15,000 children will be diagnosed with cancer. And that's from birth to the age of about 19 is what they consider children and adolescents. So about 15,000. The most common types of cancer in children are leukemias, but there's about 28% are leukemias. Second one is brain and other central nervous system tumors like the spine, but brain accounts to 26.5% of cancers. So there you see that's what, 54%, almost 55% of all cancers are either leukemias or brain type cancers. And then you have others like lymphomas, neuroblastoma, which are less. The overall 5-year survival rate has improved in the last number of years and decades. However, despite this improvement, it is said that the long-term impact of the survivors of childhood cancer is substantial. And what that means is 60% of children that survive cancer have severe complications as adults. And this is concerning because, yes, they survive, but then they're twice as likely to suffer chronic health conditions later in life. And this includes everything from strokes to heart attacks to congestive heart failure to reduced lung function. And the list just goes on and on. Kidney disease, neurocognitive issues, even cataracts, psychological issues. So it plays an impact not only for that duration of time when they're being treated, because of course, imagine on that their quality of life. And that's the thing. In childhood cancers, these children are hospitalized significantly longer than adults that are being treated with cancer. So it takes quite a toll not only on the child, of course, but on their family, right? The parents and the other sibling. So it's a lot to be said about this very important topic.
So much so. And so what we've taught, you and I have taught in both teaching to adults and in other videos that we've done together, there are ways to prevent cancer no matter what the age. It just so happens that, and I like the way you've brought up so many options here, but specifically in the area of nutrition, we want to avoid all GMO foods, all glyphosate sprayed foods. And so sometimes non-GMO will cover that category, but not always. And so sometimes we have to make sure that it's a non-sprayed grain that we're cooking with, or a non-sprayed food item that we're eating. And would you say glyphosate has a huge contributing factor to the cancers in children, especially just because of the small mass size of the children?
Yes, glyphosate. I'm really, really concerned also about EMF exposures from Wi-Fi and laptops. And, kids nowadays are on their computer all the time, whether it's for schoolwork or to play games, the laptops. And remember, their organs are developing, their pelvic organs are developing, the ovaries, the testicles, the brain. And so the risk of these electromagnetic fields, the toxicities from glyphosate and other heavy metals that may come even from vaccines, this is significant. And so it's only getting worse every day with the, what are they called? Ear pods?
Yeah.
I don't even want to know the name of them, but you see all these children having these pods in their ears, and I'm just like, wow. And the dumb watches are not really smart watches, they're dumb watches because you're getting emitted electromagnetic fields the whole time those dumb watches are on you. So get rid of them.
Yeah, I so agree. So much so. Yeah. All right. Well, what are some words of hope that you can leave with the parents from watching this video?
The hope is that, first of all, there's a lot of options that you can do to protect your children. And first of all, it is our duty, our obligation as parents. I have 6 kids and 7 grandkids. And my oldest grandkid is 9 years old, and the youngest is a year and a half. So this is a very dear topic to me. And so I need to get educated. I teach my children and son and daughter-in-law to be educated and start early to instill healthy lifestyle practices in your children. So I have older children now, and they don't touch processed sugars. They know that they're not going to eat foods that are GMO, right? They're going to exercise. They're following lifestyle practices. So it's the best thing you could do for your children is that. Teach them from an early age. This is the best inheritance that you could leave them, more than a house or a car or all the money in the bank, because life is precious. Health, without health, what do we have, right? So I encourage you to teach yourself first and then teach your children. And there is hope. There's a lot of options beyond conventional medicine that your children can be available to them. And it starts with nutrition.
It so does. It so much does. And nutrition leads to digestion, and digestion starts the whole process of either healing or of sickness. So well said. All right. Well, Dr. Tony Jimenez, I thank you again for joining us. I want every parent to have your book, Hope for Cancer's book, and just to keep learning from you. Make sure they subscribe to your email list and get those nuggets of truth that you send out periodically and just following you. And for those who are in a battle with cancer, whether they're an adult or a child, that book is going to give you some steps on how to deal with it. Whether you go conventional route or alternative route, realize there's always hope in God. And I love your story at the beginning, how your daughter, who's now, married with children, how she's been such a blessing because you were able to allow the body to heal. And the story about vaccines, that's a decision every parent has to make. But yet realize as a parent, you are still the parent of your child. Even if a pediatrician gives you pushback, you still, well, I live in the state of Virginia. I don't know every state's laws, but in the state of Virginia, you still have the right to refuse vaccinations or to choose a different time schedule for the vaccinations or to choose different options of the vaccines. And so even my husband, who worked at a university here, they were requiring him to have all these vaccinations, and he's definitely not a child anymore, but he pushed back. And he said no. And they said, well, we can give you this variation of it or this variation of or this variation of it. And even with the COVID vaccine, he pushed back. And eventually he said, I'm not going to get your vaccine. And they said, well, then you'll have to quit. And he's like, it doesn't matter. God's my provider. I'm not reliant on you to provide when this is against my principles. So he did. He left that job and he has another job now that's amazing because he works for me. So God had already presented us with that. Yeah, we need you to work in this ministry. We need your help. And so we're not bound to a job because of income, because the Lord is our provider. And that whole wrapping it up like, well, I have to have a vaccine or my child won't be accepted in a school. Then maybe God's directing you to a different school. Maybe he's directing you to a different course. There's sometimes we put God in a box as if that's even possible. And that's living in fear. And what you are all about is living in hope. And we are called to live in hope. We are not to have a spirit of fear. And a spirit of fear is anti of God. And so we always, when we walk in hope, well, if God closes, well, there's no doors and windows in God's thing. If God shows you this is not his answer, then he already has another answer for you. And when we are afraid to hear that answer, or talking with one person, they're like, yes, but I'm afraid God may ask me to do something I don't want to do. Well, that's living in fear. And God is not about fear. God is about hope, and he's about deliverance. And there is so much there waiting for us to just step boldly into what his word promises and that he is the truth. So I could get preaching here, so I better calm this down. So yeah, thank you so much for being a part of the Biblical Nutritionist family. I feel like you're one of our key doctors here with this family, and I hope we get to have more interviews with you. And I am praying a lot for your future and what all God provides for you. And tell us about your new book coming out in just a few months.
Yes, my new book coming out in March of 2025 is Emotions in Cancer, the correlation with cancers and specific traumas and conflicts that we may have had. And no matter what, we live in this sinful world and we have a backpack of stuff that we need to get rid of. And I believe it's spiritual healing, emotional healing, and then the physical healing in that order. And nowadays, medicine is totally the reverse, and it's just about treating the tumor in the person versus treating the person with the tumor.
Exactly.
And yes, and we start with spiritual, emotional, and then physical healing.
Yeah, so true. So we will be looking for your book. And then also for those of you who just want someone there to kind of guide you through this, we have the Biblical Wellness Retreat. Make sure you go to the link below and sign up for the wait list to get notified when we have our next retreat. And that's what we're going to talk about. We're going to help you to create the steps necessary for you to have, we call it our Reclaim Retreat. Reclaim what God has promised you and implement it into your life every day. So thank you again, Dr. Tony Jimenez, for joining us. And for everyone, we'll put his links down below. And for those of you being a part of the Biblical Nutritionist family, thank you for subscribe and like down below so we can stay connected. And go to our website, thebiblicalnutritionist.com. We also have a Conquering Cancer course, and that is also at our Biblical Nutrition Academy. So you might want to check that out as well. Thank you so much for watching.